In our consultations, many patients ask me how we originally came to replace patients' lenses in cataract surgery with artificial lenses. The story is a fascinating one and takes us back to the great heroes of our skies in the Second World War. Many of our Spitfire pilots were shot down in the war, and of course many sadly died, with those who did survive often having ghastly injuries. The eye doctors of the day noticed that perspex fragments from the canopies of the planes often ended up in pilots' eyes, and although these fragments caused damage, they weren't rejected by the body, an observation which led Sir Harold Ridley, a London eye surgeon, to develop the world's first intraocular lens in the 1950s. More recently, I've had the great privilege of operating on one of our wartime Spitfire pilots, Wing Commander Vince Gough. He was astounded to learn that thanks to his colleagues' sacrifices, he can now see again.
I'm now 96 and at the patriarch of the family, life has been good. I've been very fortunate, very lucky in life, and happily I'm here to be able to tell a little of the story of my life and how my eyesight has been in the professional work that I did as a photographic reconnaissance pilot on the Mark 19 Spitfire. I was a corporal then in the Home Guard, and I was flying was my love. I was their instructor on aircraft recognition, and Bomber Command suffered such tragic losses that they changed the rules a little bit and allowed people like myself to volunteer for aircrew, which I did immediately in 1941 once the option was available. And I went to assess whether or not I was suitable for aircrew training in any of the roles: pilot, navigator, wireless operator, air gunner. I was a photographic reconnaissance pilot, completely unarmed, because the object of the exercise clearly, as photographic interpretation, is to get your pictures, get back to the photographic interpreters at base who could use them intelligently to give them essential intelligence information as to what was going on, as happened in fact with one of the Spitfire pilots who photographed the first signs of the flying bombs being launched in Germany that were causing chaos in London. Eventually in the 1946 King George VI birthday honours, I was awarded the Air Force Cross for professional excellence as an advanced flying instructor. Therefore, my eyesight was the essential element in all of this professional work that I've been talking about. Simon fortunately made it all plain, straightforward, and easy to understand, which there was nothing really to worry about. It was just a bright light that shone, that there was no pain, no fear, and it was quite a satisfactory result. The joy was when Simon had done his work. When I came out, I was very concerned, and I said to my wife, "Why did you change your car?" And she said, "We haven't changed the car." I said, "But ours was a green car." She said, "No, it's not a green car at all." And I hadn't realized how important colour was in my life. Not only was the car the same car, but the colour was a blue car, not a green car. Well, that, as I say, the fact that I had the cataracts dealt with by Simon in such a perfect manner, that life has been completely changed, and it's regained its colour and its interest in a superb way, which has again made me realise that life has been good, and I've been very fortunate.